Hi, my name is Karen, and today we are doing the dynamic posture test. My participant is Harry. He's a low risk participant, which we tested before. You did a pre-screening test before we did this video. Today we have 3 exercises. We have a squat, we have a push-up, and then we have a seated row. What we're going to be looking at today with these 3 exercises is the posture of the client, making sure that they have the right technique for these 3 movements. So as Harry has done an overhead squat before, what we're going to do is get him to do it straight away, and I am going to be observing him. So with the overhead squat, he knows that his hands have to be above his head, his hips and his feet shoulder width apart, and you're pushing back down. So it's almost like you're about to sit into a chair. We're going to be identifying that he has a neutral spine and that all the weight is going into his heels, not his toes. So for the purpose of the video, Harry, would you just do it this way?
Yep.
Okay, excellent. Okay, so what we're going to do, hands up, above, yep, down. Okay, we don't want your knees to go over your toes as well. Just try another one for me. Good. Okay, as we can see, Harry has a neutral spine, which is a good indication that he's doing the correct technique. And of course, your natural curve is maintained. How do you feel about that?
Yeah, felt good.
Felt good? Okay, good. The second movement is a stability push-up. So for the purpose of this video, Harry, I'm going to just show you what I expect. So I want your shoulders, your hands in the same position, like facing downwards. And what you're going to do, this is what I need you to focus on, is that your back is neutral. I don't want to see this. I don't want to see this. Everything needs to be straight and static. And all you're going to do is lower and up. And when you are looking, try and look about 30 centimeters ahead of you. Does that make sense?
Yeah.
So your head and neck are all in line with your body. Okay. I'm going to be looking at your scapula and making sure that there's no movements there. Okay. How are we going? Okay. So remember to look up above. Okay. Now I feel like good. Now lower this butt just a little bit. Straight. Excellent. How do you feel about that? Okay, can your hands go out a little bit further? Yep, try now. Good, good. Okay, so I can see that he's in a neutral position. His head's looking at 30 centimeters ahead and everything is in line. Excellent. How do you feel about that?
Yeah, good.
Good, good. Okay, so the pulling movement assessment, which is the seated row. For the purpose of this exercise, we're going to be using a band. Okay, so what we're going to do, we are going to make sure that, that the scapula remain flat on thoracic cage, so straight up. Okay, we don't want him to be moving forward or backwards. We need you in a 90-degree angle. And what you're going to do, you're going to bring your elbows close to your ribs and back forwards. In, back forwards. This is going to make sure that you remain neutral and that we're not putting any pressure on your back. And that's what we don't want when we're doing these exercises. We want to target muscles, not your back. Okay. Okay, and looking straight ahead. Don't have your head looking down.
Yeah.
Look into the horizon. Good. I'd even moving your elbows a little bit closer. Yeah. How's that feel?
Yeah, better.
Okay, and as I can tell, he's got a natural, okay, move up a little bit forward, straight. Good. Go again. Good. Good. And one more, so because I can see that you've got a neutral spine, your pelvis position is maintained throughout the movement. And that's what we want. We really want to target these muscles. Good. So after doing these exercises, I would talk to the client, give them my feedback on what they could be improving, so they can go away and practice their techniques to help their overall health. Thanks.
All right, thank you.
Thank you very much, Harry.